Welcome to the American Lung Association webcast, Protecting Lung Health During Wildfires. I'm your operator today. My name is Jamiria. Before we begin, as a reminder, at the bottom of your screen, there are multiple application widgets you can use. All of the boxes are resizable and movable, so feel free to move them around to get the most out of your desktop space. For the best viewing experience, we recommend using a wired internet connection and closing any programs or browser sessions running in background that could cause issues. For the best audio quality, please make sure your computer speakers or headset are turned on and the volume is up so you can hear the presenters, and make sure the media player on your screen is enabled. If you have any technical difficulties during the webcast, please let us know via the Q&A box. During the webcast, you will have an opportunity to ask questions. You can submit a question to the panelists through the Q&A box. We will hold the questions until the end of the presentation. This webcast is being recorded. A recording will be available tomorrow and can be accessed using the same link you used to register. And now it is my pleasure to introduce Deb Brown, Chief Mission Officer for the American Lung Association.
Thank you, Jamaria. I am so excited to have the opportunity to kick off today's webinar, Protecting Lung Health During Wildfires. We had more than 500 health professionals register for this webinar, and we thank you all for joining. The American Lung Association's mission is to save lives by improving lung health and preventing lung disease. In the past 2 years, several states have experienced some of the deadliest wildfires in history, and as the wildfire season continues to worsen, this issue is of deep national concern. We are truly grateful for the tremendous interest, support, and continued partnerships to raise awareness and provide critical education resources regarding lung health during and after a wildfire, as well as tools to aid the public in protecting themselves. At this time, it is my privilege to introduce today's moderator and one of our speakers, Janice Nolan, who is the National Assistant Vice President for Policy for the American Lung Association. Janice supervises the development of policy positions on indoor and outdoor air quality for the American Lung Association, and she is the chief architect of the Lung Association's annual report card on air pollution, the state of air. So Janice, I will turn the program over to you.
Thanks, Deb. Thanks so much. I want to open the story reminding you that we are recording this webinar so that those who could not attend today can watch it later. So we'll also be following up with a brief emailed survey so that we can improve the future programs like this. But next, let me introduce our partners in the webinar with the logos shown here. We have, first of all, to be very grateful for the Centers for Disease Control and Prevention, which awarded us the grant funding to do this program and materials. Our other partners today are the American Public Health Association, the National Association of County and City Health Officials, the National Environmental Health Association, and our newest partner on this, the American Association for Respiratory Care. We are grateful for their partnership and for reaching out to all of you, their members, with this opportunity. As Deb introduced me, and this is my picture, I'd like to introduce our other speakers. First, we're delighted to have Dr. John Balmes. Not only is he a professor of the School of Medicine at the University of California in San Francisco and of Environmental Health Sciences at the University of California, Berkeley, along with a long list of other things, he plays a crucial role in fighting air pollution. He is a physician member of the California Air Resources Board. Our next two speakers also have lots of experiences in areas where wildfires directly impact their communities and the health of their neighbors. First is Dr. Marcy Ballman, who is a division director with the American Lung Association in Montana. And our fourth speaker is Wayne Crowell, who is a respiratory therapist in Sonoma County, California, another area hard hit by wildfires. Our slide here shows the purpose that we have today and the objectives that we're trying to achieve. We want you to know, first of all, much more about the threats that wildfires pose, but also about the resources and the tools that can help you protect your communities, your patients, and your health. So let me turn things over to Dr. Balmes. John?
Yes, so I'm charged with talking about the impacts of wildfires on respiratory health. But before I go on, I especially want to give a shout out to my respiratory therapy colleagues. I'm a pulmonary critical care doc at San Francisco General Hospital and know how important respiratory therapists are to taking care of my patients hospitalized at that facility. I'm going to talk about wildfire in general, a bit about climate change, which is really driving our increased wildfires, what's in wildfire smoke, a little bit about health effects, and a little bit about post-fire issues. So, you know, millions of Americans have lung disease, and in fact, for that matter, wildfires are occurring around the world, in Europe, in Asia. So there are many millions of individuals who are at risk for the health effects of wildfires. As of 2017, 36 million Americans have lung disease, and 25 million Americans have asthma, including about 6 million children and 15 million adults with COPD. So a lot of folks are at risk, are a susceptible population with regard to wildfire smoke. Now, I already mentioned that climate change is the driver of wildfires. This slide shows that there are many other problems related to climate change that impact public health in general and respiratory health in specific. So, of course, there's heat waves, and I think that it's not just California, where I'm from, that's been challenged by heat waves in the past few years. It's really most of the country, and especially when there aren't enough days, where there are many days in a row, not enough cool nights, that people actually die from heat stroke, especially those with pre-existing heart and lung disease. Ozone will be increased with global warming, and there also will be increased particle pollution. Mostly in efforts to adapt to climate change, we have to use increased power for air conditioning. And again, focusing on respiratory issues, asthma, especially allergic asthma, is predicted to become more of a problem because we'll have greater exposure to allergens like ragweed due to changing climate impacts on vegetation. So this slide, unfortunately, shows multiple catastrophic wildfires in California over the last couple of years. Wayne Crowell is going to talk about the Tubbs Fire later. That was the one in wine country, Sonoma, Napa, that wiped out a neighborhood, Coffee Park neighborhood. The Woolsey Fire was in Southern California, caused massive evacuations. Fortunately, not a lot of deaths. The Carr Fire was a fire that swept through Redding, California and adjacent towns and did kill a number of people, including some wildland firefighters. And the Camp Fire is the infamous fire of last November that destroyed the town of Paradise. And you can see from this satellite photo that the entire northern central valley of California, it was filled with wildfire smoke, and then the smoke came out to the Pacific through the San Francisco Bay Area where I live, and our air quality was very poor for over a week because of this fire. And on the bottom is the Thomas Fire. You can see this satellite photo shows multiple fires, really. It was a complex, and it was the biggest fire in California until last summer, biggest wildfire ever, but it also was the latest, so that's an important point. Most of these fires occurred in the fall in California, not during the hottest period of the summer, but in the fall when we have windier conditions, and if the normal fall rains don't come in time, we have very high-level fire conditions. And so this Thomas Fire actually occurred in December and wasn't out till around Christmas. And we're not the only state. Montana. You'll hear from Dr. Ballman later about Montana. Oklahoma's had bad fires, and one of my former doctoral students is a U.S. Forest Service wildland firefighter and researcher, and she's been up in Alaska this summer fighting major fires. Fortunately, I guess, is that populations aren't put at risk from these big Alaska fires because it's so the fires have been so remote for the most part. And this is just putting in perspective for the nation. Over the last couple decades, you can see this increased rate of catastrophic fires. And for 2018 alone, 58,000 wildfires, almost 9 million acres burned, and 26,000 structures burned. So it's a big problem already, and it's only going to get worse with continued climate change. And this slide shows how many fires there were last year. I think this is this is a slide from last summer when there were multiple fires in the Pacific Northwest in California, and really massive plumes of wildfire smoke moved east. And I was at a wedding in Montana, in Helena, Montana, during this time, and you could see the plume of smoke in the upper atmosphere coming across from farther west. I thought I had gone from California to Montana to escape wildfire smoke, but it followed me. It was quite impressive when I hiked up in the mountains outside of Helena. You could just see the smoke moving eastward, and the plume showed up as far east as New England. So what's in wildfire smoke? Well, there's primary pollutants. These are emitted in the actual fire smoke, and particulate matter, especially the fine particulate matter that can make it all the way down into the alveoli of the lungs, that we sort of worry the most about in terms of health effects. Immediately in the fire field is carbon monoxide, and wildland firefighters are at particular risk for exposure to carbon monoxide as they're fighting fires. Oxides of nitrogen are generated whenever carbon-based fuel like vegetation, trees, burns is emitted. And then polycyclic aromatic hydrocarbons, PAHs, they're some of the carcinogens in tobacco smoke, and they're also present in wildfire smoke. So there's concern about lung cancer, not in even bad single community wildfire episodes, but of wildland firefighters. There are career U.S. Forest Service firefighters, and there's been estimates that they have an increased risk of lung cancer even if they don't smoke because of their recurrent exposure to PAHs. And then volatile organic compounds, these are the nasty irritant gases like formaldehyde and acrolein that are part of why wildfire smoke is irritating to the eyes and throat. And then there's secondary air pollutants. In addition to the particulate matter, the carbon soot that's generated in wildfire smoke, there's secondary transformation of pollutants, VOCs, and oxides of nitrogen into particulate matter and ozone. And then when buildings and vehicles burn, we have other toxicants. So this is the Coffee Park neighborhood burning. This is the neighborhood in Santa Rosa that was taken out by the Tubbs fire that Wayne will talk to you more about. And when buildings and cars burn, that's what we call structural fire smoke, and that contains other toxic air contaminants aside from the ones I've already mentioned, including cyanide, hydrochloric acid, phosgene, metals, and dioxins and solvents. And so local residents in towns adjacent to wildfires like Santa Rosa in the Tubbs fire or paradise with the campfire, they're exposed to more than wood smoke. So who's most at risk from wildfire smoke? Well, basically the same populations that are at risk for air pollution in general. So infants who have developing lungs, young children who might be very active outdoors and get a greater exposure, same for teens, especially teens that play sports during wildfire smoke episodes. Older people, especially those with pre-existing heart and lung conditions, but also diabetes is a risk factor. And, of course, even kids with asthma are particularly at risk. Outdoor workers because of greater exposure. So in California, agricultural workers and construction workers are at the greatest risk because of, have the greatest exposure and therefore at increased risk. And Cal OSHA just put out an emergency regulation for this fire season for outdoor workers to be offered N95 masks when the air quality index gets above 150 during a wildfire episode. And then wildland firefighters get way more exposed than any other group because, unfortunately, unlike structural firefighters who can wear respiratory protective gear, got air packs those are totally impractical for wildland firefighting condition. Firefighters out on the fire lines for long periods, 12-hour shifts, they're working very vigorously, so they have increased minute ventilation, greater dose, and they can't wear, there's no equipment that's available that protects from carbon monoxide at the same time it protects against particulate matter. But that's a bit of engineering that we still need to implement. So there's a lot of literature about wildfire smoke and respiratory health. Summarized on this slide, asthma exacerbations show up as associated with wildfire smoke in nearly every study that's been done. Exacerbations of COPD are usually associated with higher wildfire smoke in most studies. And there's increasing evidence of a link between wildfire smoke and respiratory infections like pneumonia and bronchitis. Again, we'd expect this. If your alveolar macrophages, the cells patrolling our alveoli are full of smoke particles, they're not as effective at phagocytizing and killing bacteria. And fine particulate, PM2.5, that particulate that's small enough to make it into the deep lungs, has been shown in outdoor air pollution studies time and time again to be associated with increased risk of premature death from cardiopulmonary causes. And there's also evidence of increased mortality in infants and young children. And we don't have that much wildfire smoke PM2.5 data, but that's growing as well. Whoops. And this study was done by a UCSF medical student in conjunction with US EPA and the California Department of Public Health. This was a study that looked at the 2015 fire season in California, so not the last two really bad years. And in 2015, they were able to show that on days when wildfire smoke particulate matter was high, there was increased risk in healthcare utilization for all cardiovascular disease, heart attack, heart failure, stroke, and all respiratory causes. And actually that the cardiovascular effects were similar in magnitude to the respiratory effects, which are much better known. And since this paper was published in 2018, there's been several other papers showing the same thing. So we're starting to have the same kind of evidence for wildfire PM2.5 and cardiovascular and respiratory mortality that we have for other types of outdoor air pollution PM2.5. So it's not just during the fire that there are health problems. The recovery after a fire is challenging. Again, Wayne Crowell will know this from his experience in Santa Rosa. There's smoke smoldering for days after the fire is really supposedly put out, and there's ash. And in a neighborhood like this gentleman is cleaning up, the ashes can be quite toxic in terms of heavy metals, for example. And there are all sorts of problems. Housing, especially for low-income folks. This was a problem in Santa Rosa. It's a problem up in Chico, which is the nearest sizable town to Paradise. And public health and medical facilities get overloaded. We were on the verge of a breakdown in our burn units, overload of our burn units in Northern California after the Camp Fire. Just barely averted a disaster in that regard. And, infrastructure takes a while to get back in place. Water, gas, electricity, cell, phone towers, et cetera. And what I'm often involved with is trying to get health departments, county health departments in California, to beef up their public health response, be ready in advance to have a clear message for what the public should do. This slide also shows a publication that's a joint CDC, EPA, California Department of Public Health brochure on wildfire smoke, a guide for public health officials. This shows the last version. A new one is about to come out any day now. I've seen an advanced version. It's new and improved. And this is a very good resource for folks who want to know how to communicate with the public about wildfire health risks. And I'll stop there and turn the baton over to Dr. Ballman from Montana.
Thanks, John. This is Janice Nolan. Before you do, we've got one question we needed to see if you could help answer.
Okay.
The question is regarding the California wildfires of 2017 and 2018. Is there any evidence that they were specifically caused by climate change?
No. I think California and the Mountain West, the ecology of our forest is actually built around fire. Small lightning fires are actually necessary for the health of redwood forests, for example, because it clears out the underbrush and lets the redwoods grow better. So we've always had wildfires, but what we have now is a combination of years of fire suppression, which I hadn't mentioned, so I thank the questioner for this, years of fire suppression where the U.S. Forest Service put out fires as soon as they could. So we have forests that are overloaded with vegetation that's ready to burn, and dead trees, for example, and then hotter, drier conditions due to climate change. So we've increased the risk of wildfires with climate change on top of the sort of base fire ecology of the Mountain West.
Thank you so much.
Because things are getting warmer and drier, it's predicted that we'll have more and more fires.
Thank you. Thank you so much. And as you mentioned, time to hear from Dr. Marcy Ballman. Marcy?
Thanks so much, Janice, and thanks everyone for joining us today. I'm going to talk about some evidence-based methods for reducing wildfire smoke exposure, especially for those with lung disease. So first and foremost, in preparing for wildfires and weather extremes and other emergencies, it's important to have an action plan for those with asthma and COPD. So these plans, I'm sure you recognize, are an asthma and COPD action plan. They have the green, yellow, and red zones. They should be completed with your patients and can include wildfire smoke as a potential trigger to acknowledge and to avoid whenever possible. There are many plans available, and the Lung Association has these available on our website to download. You'll see the web addresses there. The American Thoracic Society just published an article last month about the hierarchy of controls to reduce exposures to particulate matter from wildfire smoke in order of priority. This is the classic hierarchy for occupational exposure, but applying it to wildfire smoke is novel. So the underlying principle is to control the hazard as close to the source as possible. That's the bottom of the pyramid, elimination. The controls are prioritized in descending order, with the highest exposure reduction, again, at the bottom of the pyramid, starting with full elimination of the hazard at the source. That would be fire prevention, fire suppression, and then ultimately patient relocation. Moving up the pyramid to engineering controls, we're talking about filtration by buildings or adding more air filtration with portable air cleaners. We'll talk about those a little bit later. And then up to administrative controls such as staying indoors, reducing physical activity, and then finally, personal protective equipment or respirators. Now, based on these principles, respirators are only to be used when higher level controls are not feasible or haven't yet been implemented or kind of in fast-acting emergencies. It's also important to know that while respirators can reach 90% or more effectiveness, they have 0% effectiveness if they're poorly fitted. I'll talk a little bit more about masks and respirators in a few slides. One straightforward recommendation we can provide to people impacted by wildfire smoke is to replace their home furnace filter with a high MERV rated filter. MERV stands for minimum efficiency rating value, and the higher the number, basically the tighter that material and the smaller the particle that filter is going to capture. Some home HVAC systems have a maximum MERV operating level that should be listed on the furnace. You don't want to put in a filter with too high of a MERV value in a system that's not strong enough to sufficiently move the air through it, because those particles just won't be captured, the air won't move. So it's important to know what each system is capable of and not just one size fits all, the highest MERV possible. Also, home and car ventilation systems should be set to recirculate to avoid bringing in new smoky air into the system whenever possible. The other major suggestion we give to individuals with lung disease impacted by wildfire smoke is to get a portable air cleaner unit for their home. Sometimes they're called air filters, HEPA air filters. They're not always HEPA. They kind of go by a number of names. But a comprehensive review of current research as of early 2018 by the EPA indicates that intervention studies of these air cleaners operating in homes have consistently found statistically significant reductions in indoor exposures to PM2.5, those tiny particles, PM10, and or particle number counts. Most studies report a 50% or higher reduction with the use of HEPA air filters. HEPA stands for High Efficiency Particle Accumulator. These filters typically have a MERV rating of 13 or higher. And a few studies have looked at the health outcomes associated with the use of these air filter units and markers of allergy and asthma and cardiovascular health, but the evidence is really not clear yet as to an impact of these units on health markers. An interesting study published in Indoor Air recently demonstrated that filtration interventions, such as using portable air filter units, could substantially reduce wildfire-related hospitalizations and deaths. This analysis really recommended filtration interventions in homes when wildfires are burning at a minimum, and found the highest economic benefit in terms of healthcare cost savings imposing these interventions in homes with elderly residents. So HEPA air filter units are not one size fits all. When someone is purchasing an air filter unit to protect their lungs from wildfire smoke, they need to ensure that the unit is appropriate for the square footage of the area that they're trying to clean, the air they're trying to clean. For example, a smaller unit may work in a small bedroom, but not in a large living room. Some units also use an ionizer to give particles a static charge, which causes those particles to drop out of the air so they can't be inhaled. So it technically is cleaning the air. But to create this effect, some of them create ozone, which is a potent respiratory irritant. So people with asthma and COPD should be especially careful not to purchase an air filter unit that will generate ozone within their home. Some air filter units require regular maintenance depending on how many particles it's removing from the air, including cleaning and replacing filters. There are also several videos out there that tend to make the rounds every wildfire season out here out west that demonstrate how to create your own air filter unit using a HEPA furnace filter attached to a box fan. But there are some concerns in this field about the fire risk of overheating the box fan and starting a fire. I've yet to hear of a first-hand account of this being a source of a fire, but if you don't know what kind of fan the consumer is going to use and what state the fan is in, there's a potential for that risk based on the strength of that fan's motor. So all portable indoor air cleaning devices sold in California must be certified by the California Air Resources Board. And to be certified, they have to be tested for electrical safety and those ozone emissions. And their website has a comprehensive list of the brand name air filter units that are certified. So swamp coolers work by taking in hot, dry air and using it to evaporate water from its pads, which it then turns into cooler air. This cooler air is then sent into different rooms of the house. So it's a different type of air conditioner type unit. But swamp coolers are used extensively in the western United States, and public health officials typically warn residents to turn off swamp coolers during wildfire events and ask them to rely on air conditioning or portable air filters or portable air purifiers, because swamp coolers bring in such large quantities of air from outside. So if it's smoky outside, it's really pulling that air inside. So be sure to ask your patients what kind of cooling system they have and advise them not to use the swamp cooler during heavy smoke events, while also keeping in mind that heat is dangerous. And if they must use the swamp cooler, we advise them to create a designated clean airspace in their home with the use of a portable air cleaner, such as designating their bedroom as a clean airspace and having that filter unit running at all times, since lab studies typically show a moderate particulate matter reduction with swamp coolers, not as much as air filter units. So this slide demonstrates what a consumer is faced with when they go into a hardware store to buy a mask to protect their lungs from wildfire smoke. The mask on the left is a dust mask, while the mask on the right is an N95 respirator. They may look similar, but the differences are crucial. Dust masks have no protection against PM 2.5, and they're meant to filter large quantities of dust while mowing and gardening and so forth. N95 respirators have received the NIOSH designation that they filter at least 95% of airborne particles when fitted properly. They need to be snug against the face to work properly. Facial hair is a really common reason that someone can't be fit tested, which means that they wouldn't be cleared to work in an occupation where a respirator is required. And so the mask won't fit tightly if someone has sideburns or a beard or a mustache. So properly fitting N95 masks will also increase the effort needed to breathe, since people are pulling air in through that tight filter. If it fits tight, it shouldn't be coming in through the sides. It should come through the paper filter. So that should really be taken into consideration as well when asking or recommending a person with lung disease to wear an N95 mask. So as was mentioned before by Dr. Barnes, the aftermath of a burned area is not just wood smoke ash in places where houses and commercial structures have burned. Toxins from chemicals and cars and cleaning products that may be in the dust really need to be taken seriously for lung health. People with lung disease should not be participating in any cleanup, and this slide lists the same type of hierarchy of controls people can utilize to reduce their exposures during cleanup. This includes dust reduction with wet cleaning methods, use of personal protective equipment, and avoidance and elimination if there's risk for any asbestos or other hazardous material. So that's all I have, and I will pass it on to Wayne.
Okay, I've got a short video that I want to show you first. It kind of gives a feel for what it was like around the hospital. I'm going to really speak to what worked well with evacuating the hospital and what didn't work well and the obstacles you may run into. So I'm going to show that short video next. It's only like 2 minutes long, and then we'll talk about it. I want to apologize for my slides. I was unable to get the original slides, so I had to scan these off of a poster that the hospital had made. So they're a little blurry, but hopefully you'll be able to see it. So here we're going to show you the video here. It's just a short 2-minute video.
I received a call shortly after 1 a.m.
Got in my car and headed here, and then I saw the fire and felt the wind. The wind was insane.
You could see the hills glowing.
There were ashes falling on my car.
Well, as I came up the freeway, the mountainside behind the facility was on fire.
We started receiving patients in our emergency room door and evacuees. They were covered in soot, with clothes burned, covered in ash, and they were just so afraid. They kept repeating there was no time to get out. There was nothing we could save. The charge nurse said, let's set up for triage immediately. And this is where we started pulling together as an amazing team.
During those first few hours, we were actually out here doing our best to stop the fire from hitting critical points. We started with the oxygen tanks. There's an oxygen tank that leads in the facility, some diesel tanks. The fire was about 10 to 20 feet away from one of those tanks.
We were out there with garden hoses and 5-gallon buckets and shovels trying to put out the fire.
It was pretty impressive to see them out there just working so hard, right side by side with us, you know, just trying to protect their work and protect the patients.
The smoke was inundating the building. It was pretty bad. You couldn't see down the long hallway in the back. You couldn't see from one end to the other.
We ended up pulling in the residents. They started showing up. More and more doctors started showing up.
Then I got a call at 2 a.m. on Monday morning that there were flames starting to get close to the hospital. We might need to evacuate. I'm thinking I gotta get there. I gotta get to the hospital. I wasn't able to get anywhere in my truck, so I went back and got my motorcycle because I knew I could get around traffic and debris better.
The flames were getting closer and closer, and we had made the decision that it was about time to evacuate, and it was then that the Sonoma County EMS called us to tell us it was a mandatory evacuation.
Sutter Health has never evacuated a hospital in its history.
Okay, that was kind of an overview of what we saw at the hospital when we got there. I kind of wanted to talk about what really happened, how it worked, and all that. So I was kind of give you my story of that night. The fire, I was actually the lead therapist, and my boss was actually out of town, so I was kind of in charge that night. And so I really felt that I had to be there. I was at home when the fire started, and being on the Emergency Management Committee, you know, we've talked a lot about earthquakes because we live in California. We did a lot of training for internal fires, you know, fire extinguisher training, all that stuff. And also we didn't talk so much about flooding because we're not really in the floodplain, but, you know, external fires was really not a big thing that we talked a lot about. So I got the call. Well, actually, I heard there was a fire, so I called into work and talked to one of the therapists, and he said they were going to evacuate. So I attempted to get to the hospital, got in my car and drove down there. And this is what I saw when I came up over the overpass. That's the picture of the hospital in the lower part. You can see it's kind of blurry there, but all you could see was flames all around. The fire had started over in Calistoga, which is a little town kind of east of us, and it had moved 12 miles in the first 3 hours. We had winds up to 60 miles an hour that night, and it was really blowing. And the embers were going way ahead of the fire, as you can see. They were, that's what really pushed it along. This is a picture of a dog. It's hard to see there. We received a lot of patients with smoke inhalation, and we got this family that had decided they couldn't get out because they were trapped, so they jumped in the swimming pool to try to save their lives, which it did save their lives, but both of them got bad smoke inhalation and it ended up intubated and put on ventilators. Well, in the process of all that, when I ran into the ER, I was there, one of the ER techs told me she had a dog laying on her lap, and she said, Wayne, the dog's not doing very well. I said, okay, here, hang on a second. So I ran and got an E-tank, and I got a simple O2 mask, and I said, just hold it by his nose. And then I went about business of helping to get the patients transferred out and moved to ambulances. Later on when I came by, she said, hey, he went to sleep. So I said, well, he's just like the rest of us and probably got some bad smoke inhalation. And actually this dog belonged to the two people that were intubated in the ER. And later on there was an article in our local paper that talked all about them and their dog and how they'd all, the process they'd been through. So we're glad of that. while helping the patients being transferred into the ambulances and moved out. We moved the critical care patients first, and then we were moving the other ones, and I was watching as I moved them out to the ambulance. The winds were blowing the embers so fast and stuff, they went across 6 lanes of freeway that we have right by our hospital and started the redwood trees across the freeway on fire on the bottom. And I was just amazed at how far and fast it could go. And across 6 lanes of pavement is just amazing to me. We evacuated, 77 patients that night. We had many inpatients. We also had the ER that was full of patients. We only had 10 ventilators in our hospital. We used every single one of them for patients that night. And also we had about 100 community members. I don't know if you saw a picture of people coming and going in the front door. A lot of the people that couldn't get out were brought in by emergency personnel, by policemen or whatever, and they just dropped them by our hospital because we had the lights on and they didn't know where else to take them. So they brought them to our hospital. So we had a big crowd of people in the emergency room, also in the front of the hospital that just didn't know where to go, what to do. So that's where they were. So what they did is they got buses to come in and bus those people out as quick as they could to another evacuation center was away from the hospital. The other thing that really amazed me was the ambulances that came. They came from all over the place. I'm going to address the things that needed some improvement and the things that worked well. So I'm going to start with the things that worked well. This is a picture of kind of a command center, and that was one of the things that really went well. We had like 4 people in the command center. This is a big picture, or bigger afterwards. But just them running the show was really impressive to watch. They're getting places for the patients to go and making a lot of phone calls, trying to get things lined up. I was really impressed with the placement of the patients. They had to find places for all these patients and also had to know where they went. They can keep good track of that so that they could tell family members where they could find their family members. So that was really, it worked well. It was all on paper, but it worked very well. And the staff really came together. Everybody was doing it, the lab people, PT, anybody that was there that night, and PT wasn't there, but a lot of the other ones just pulled together and we did what needed to be done. It wasn't like, you stayed in your own role. You did whatever needed to be done. Some of the things that need improvement is if you had some issues getting to the hospital. I had 2 other staff members that tried to get there, and they both were turned away. I had a lot of doctors come to me afterwards, and being part of the emergency management committee, we talked about this afterwards, and they were turned away. I got to the first checkpoint, and they wouldn't let me go, so I went to the second one, which they let me go, and that's how I got to the hospital, but a lot of people weren't there. So if you're in your county, you may want to talk to the county or law enforcement, however they do it, and see if you can get it so that an emergency that hospital personnel can get there, because that can be a big obstacle. And we did that with the county too in one of their meetings. Another issue was they took these supplies out of our supply room in the ER and put them on tables thinking it would be quicker. Well, the problem with that was couldn't find anything. So I don't think that worked really well. So if it had been in the supply room, I could have got it in 2 seconds, but I had to look for stuff. And just to get a nebulizer took me about 10 minutes to find it so I just didn't think that one worked real well. And then the other big problem we had was communication. With the fire, all the cell phone towers went down. Most of the landlines went down because power lines were burnt. The only thing that really worked was the Spectre link in the hospital, and I was able to call my wife on that and tell her that I was safe and okay there. That was the only way I could get through there. The hospital itself did not have any burning except for the Shea House. Shea House is a place that the mothers and dads could stay if they had a sick infant in the NICU. We had 8 babies that were transferred out before I got there too, also from the NICU that night. There was a family staying in the Shea House that night, and they had to get evacuated before that. And that was the only building we did lose. The reason the hospital survived is we had a flat roof with a rubber roof, and they put people up on top of the hospital with fire extinguishers to put out any spot fires that came up, and they used every extinguisher we had in the hospital that night. That night there was 2 major hospitals. Us and Kaiser were evacuated, and this is kind of an overview of what happened in the area. There was 100 Sutter staff and physicians lost their homes. Overall, there was over 200 homes lost by hospital workers in the area. It burned 36,000 acres. 5,643 structures were burnt. More of them were burned in Santa Rosa, and that was in the Coffee Park area. 22 people died in the fires. The hospital has water in the back, has 300,000 gallons of water, and the fire department used that to help fight the fires, which they were very thankful for. And this is just a picture showing kind of what the air quality was afterwards. And the fire burned from October 8th through October 31. And we had many, many, many days like this. So you think about that, you know, all the stuff blowing around and all the pollution and stuff, you know, we really got a lot of exposure. And I think, you know, this last year we had the campus fire in Paradise, and we had a lot of days like that again. So I really think of all the stuff going around. And since this whole talk is about air pollution and what it does to you, you just kind of wonder what's going to happen in the near future. I know we have a lot of fires in California, and hopefully we won't have this experience again, but who knows? And I'll turn it over. Thank you.
Thank you so much. This is Janice Nolan back to wrap this up and to be, first of all, very grateful for all the folks who shared such incredible stories and information with us, and it's just so helpful. But we also have some additional resources we want to make you aware of that will be, we hope, useful to you, and we think useful to you as you prepare in your communities and in with your patients and with your the folks that you're working with in your counties and cities to prepare for what will be more fires in this next year. First of all, I want to make sure you're aware of the airnow.gov website. This is sort of the master website nationwide of what air quality is like across the nation. And they have specific information on wildfires. You see the circle there with red. That is the place to go to learn more about wildfires. But you can also, you'll see the map that is there, and the map shows what the air quality is like based on the scale that's on the left side there, talking about when air quality is good, moderate, unhealthy for sensitive groups, all the way up to hazardous. And the picture is pretty big there with the U.S. map on it, but you can actually go to your zip code or go to your state and counties and find what the air quality is like, what the forecast is, and what it's expected to be today as well as in the future on this website. So it's a very useful tool for more information. Another site we have is the Lung Association. We have information on our website that have minute-long animated videos available both in English and in Spanish. They can have tips on it to help prepare lung health during wildfires. You can find them again at our website at lung.org/wildfires to try to take all the stuff we've been sharing and put it into something that's a little more easily accessible for the public. We have a lot of information on our website as well about climate change and health, including some new resources that we are putting together so that people can be prepared not only for wildfires but other aspects of climate change and health. And on our website we have, and we have shared with our partners in this, certain tools to help prepare this information. These two are fact sheets that we have targeted for your audiences, for your people in your communities, for patients at your hospital, to help them know about what is the facts about wildfires, about climate change, and about things that you can do for the whole array of harm associated with climate change. We're preparing materials right now for wildfires specifically, and all of these will be available, these two are available right now in both English and Spanish, and the ones that we're putting together on wildfires we'll have ready shortly will be available in English and Spanish. You can download them and share them, or send the links to the folks so that they can download and access it as well. There are a lot of other resources that have been put together to help you. I list a few here, including the American Lung Association's website, the CDC's web information. The Department of Homeland Security has a good resource on ready.gov for a lot of disasters and a lot of planning, wildfires especially. EPA also has the toolbox. You saw a picture of the booklet that Dr. Bobbs was mentioning has been updated and is about to be rolled, I think updated again, as he said. Lots of good information about preparing for wildfires and responding to them because these are devastating and complicated processes, events that happen, that occur and affect millions of people. We also want to make sure that you are aware that we've been trying to keep our community of health professionals more aware of what's going on climate change, and resources that are coming available for you and for the public health and environmental health and medical community. So we have a regular update that we called Climate Changes Health for health professionals. If you want to log onto that site, you can get that newsletter on a regular basis, on a monthly basis, providing information and opportunities for you to be able to take action and learn a lot more about it. So with that, we're ready for questions. We've had a few questions come in that we've tried to get. What other questions do we have?
Absolutely, and we'll take our first question. What puts diabetics in the high-risk category?
This is Janice. Let me try and answer that. One of the things that we have learned is that particulate matter especially harms people with cardiovascular disease. And people with diabetes more often have cardiovascular disease with it as well. But in addition, there's studies looking at particulate matter, particle pollution, that have found that people with diabetes are also at higher risk just because of the body's response to it. They're not the only groups. We're learning a lot more about other groups that may be at risk, and those are being sorted through right now, so we don't have a long other list. But questions are looking as we get into some of these pollutants and finding how they can affect multiple organs within the body, not just the heart or the lungs, but the brain and a lot of other areas that we know we need to make sure that more people are aware that they face higher risk because of air pollution and particle pollution specifically.
Great, thank you so much. This next question came in during Wayne's presentation. Do you use carbon monoxide oximetry?
The answer to that is only through a blood gas, really. We didn't have much chance to do much of anything at that point. It was really just to get the patients out. So it was more of a crash situation, so I can't even remember drawing one blood gas. At that point, it was get the people on the ambulance and get them out. But we do it, you know, with a blood gas. They could do oximetry or carbon monoxide testing. So.
Great, thank you so much. We have an additional comment. Also go to the EPA's SmokeSense mobile application that brings you the AQI fire locations and more, and there is a link here that is recommended that has been sent over by a participant as well.
Great, thank you.
Absolutely. And our next question, does the updated Wildfire Smoke Public Health Guide address the past discrepancies between the guidelines provided for employees and the general public exposed to wildfire smoke?
I'm not sure what the updated one's going to cover, but the previous ones that I have seen, this is Janice Nolan again, cover a great deal of information. There's a 2016 one that I'm not sure I could answer that question, but I do think they do cover a wide range of information about not only the health effects, but looking from both the CDC and EPA and other perspectives, trying to provide information about this wildfires and how to protect yourself.
Great, thank you so much. We have a participant asking, can we use these slides for teaching a CERT class?
We have the webinar available for you to download and use, or to be able to access and use, so you're welcome to use that. The slides individually, if you've got specific requests for individual slides, please let us know.
Wonderful, thank you so much. Our next question. Medicare won't provide diabetics extra insulin in case of emergencies or disasters, which seems at odds with what FEMA would recommend. Are you aware of any ways to get exceptions?
I don't have any information about that. Those kinds of questions are outside of our turf. I don't know if any of my other colleagues have insights into that, but I think we are working in a different area of the issue in this area. Sounds like we don't. Sorry. Thank you.
Wonderful. We have a thank you from a participant. And I believe that is all the questions we have at this time.
Wonderful. Well, thank you so very much. Oh, yes, one more?
My apologies. Yes, one came in right as I said that. How does the elevation affect the matter that is generated by fires, and how does it affect the general public? Sea level fires in California versus Montana fires.
Well, one thing that we do know is that the topography can affect how air pollution moves, how the wind moves, how the pollution moves. So if you've got an area where it is in a basin, often that can allow the pollution to collect and to build up and not be able to blow away, as you might have if you had some, say, that was in an elevated area, like on an edge of a bluff or a mountain. What we do also know is that wildfire pollution can blow extensive distances, as you saw in the images, all the way to the East Coast. We've seen a lot of places, even now, that are affected by the fires in Canada that are blowing into Washington State or Montana or even into the Midwest and other places. So definitely the elevation can make a difference based on how effectively the wind can blow the emissions away, can blow that smoke away, or if it gets built up, which we see a lot happening in some areas that have basins in them particularly. You'll have many, many more high days because the elevated levels just don't get blown away. On the other hand, elevated levels that are really high can have wildfire blow, smoke blow in great distances. And so they have the geography, the topography can make a difference in where the concentrations are, but how far away they spread, all of those things.
Great, and we have received another thank you for this information. Lots of folks are very grateful. And I think with that, that is our last question.
Wonderful. Well, thank you all so very much. We really appreciate all that you're doing in your communities. And what we're trying to make sure we can do is provide you with the tools and information that can help you make an even more effective impact on your communities and your patients. Please know again that we will be submitting a quick survey on email to you in the next few days, and we will get that out. And if you could return it, that would be helpful to us. And we'll be providing you an update with a link and information about the additional fact sheets that we're putting together for you in the future. And we would love, and we'll do another survey back in another few weeks, to ask how effectively these tools and resources have been useful for you. We really would like to know how better to improve this so that we can make future webinars that we do, future opportunities like this, even more effective. But again, thank you all so much for the hard work that you do. We really do appreciate being your partners. With that, I'll say goodbye. Thank you.
Thank you for joining us for the Protecting Lungs Health During Wildfires webcast. You may now disconnect at this time. Presenters, please hold.